Namaskaram andi. Na peru Dr. Neetimala Mekala. I am working as an obstetrician and gynecologist at Medicava Hospitals, Chandanagar. Today I will be addressing regarding certain most frequently asked questions about cervical cancers and HPV vaccinations. So first of all, we need to know cervical cancers are the second most common cancers among Indian women, and India attributes to around 1/4 of the global burden of cervical cancers. And majority of them, around 90% of these cervical cancers are caused by human papilloma virus infections, that is HPV infections. What are these HPV infections? Human papilloma viruses, these are one of the causative agents for sexually transmitted diseases, and they are responsible for majority of the cancers because they have a cancer causing potential in them, and they lead to, or they are responsible for many cervical cancers, anogenital cancers like vulval cancers, vaginal cancers, penile cancers, anal cancers, oropharyngeal cancers, and around 90% of the genital warts in both boys and girls are attributed by these human papilloma viruses. Cervical cancer has a long latency period, that is the period between the start of infection and the development of the disease would take around 10 to 20 years, and in this time span the patient may not show any signs and symptoms. And in Indian settings, majority of the Indian women do not seek a medical help or a gynec consultation unless and until they have signs and symptoms. Remember, in early stages of cervical cancer, women doesn't present with any signs and symptoms. Cervical cancers can be prevented by vaccinating all young females against human papilloma viruses, and also by screening and treating all precancerous lesions in the women. So coming to human papilloma viruses vaccinations, the most frequently asked questions are, what is the age group where we have to get vaccinated? Usually we can give vaccines from the age of 9 to 45 years, but the most targeted population for the vaccination would be around 9 to 15 years of age. The dosing of human papilloma viruses is depends on the age of the population. Around 9 to 15 years of age group, we do give 2 doses, and above 15 years of age we give 3 doses schedule as per the protocol. In pregnancy and lactation, we do not recommend human papilloma virus immunization. So what are the different types of HPV vaccines available? They are we have bivalent vaccines, quadrivalent vaccines like Gardasil, and also recently launched nonavalent vaccine is also there. So the choice of the vaccine you can discuss with your gynecological expert, and you can get advices on that, and you can choose one among those. According to the recent data published in the Lancet, through National HPV Vaccination Program in England, UK, there was around 80 to 90% risk reduction in the incidence of cervical cancer in their vaccinated population compared to the unvaccinated population. So it's never too late to start. Prevention is better than cure. If you have any queries related to cervical cancer screening methods or HPV vaccination, kindly reach us at Medicava Hospitals, Chandanagar, get your doubts clarified and get vaccinated.